Welcome, everyone. Thank you for joining. This is a Delphi Insight Session. My name is Leah Mix. I am the CEO of Delphi, a consulting firm dedicated to the advancement of psychedelic healthcare. Today's session will highlight the essential role of the Psychedelic Medicine Association in moving psychedelic therapies into mainstream healthcare and ensuring broad, safe access to these promising treatment modalities. We will start with a brief overview of the challenges and opportunities of bringing psychedelics into the U.S. healthcare system and achieving insurance coverage for these therapies at scale. This foundational information will be useful in itself, and it will also help us to contextualize and better appreciate the work of the Psychedelic Medicine Association, led by Dr. Lynn Marie Morski. Now, this is a critical time in the emergence of psychedelic therapeutics and the realization of their potential for human flourishing. While MDMA-assisted therapy has been nearing the finish line of FDA approval, a recent FDA advisory committee made up of a spectrum of stakeholders in the healthcare system expressed strong doubts about the safety and efficacy of this treatment. The committee recommended that the FDA not approve MDMA-assisted therapy at this time. Now, the FDA does not have to go with the committee's recommendations, but the committee's concerns highlight the realities of what it means to bring not just a new drug, but a new clinical specialty into the U.S. healthcare system, and why it is critical that organizations like the Psychedelic Medicine Association that are designed to interface with the incumbent medical community and healthcare systems are essential to the viability of psychedelic therapies becoming accessible medical treatments. After working for 12 years in direct service as a behavioral health clinician and 15 years in the commercial health insurance industry, I came to work in the field of psychedelics. Over the last 8 years, I have helped the field establish multiple organizations, such as the Board of Psychedelic Medicines and Therapies and Enthea, all playing different roles designed to interface with the incumbent healthcare system and pave the way for psychedelic-assisted therapies to become accessible after FDA approval. Today, Delphi advises a broad spectrum of clients inside and outside the field of psychedelics, from the U.S. federal government and state governments to psychedelic pharma and care delivery organizations and venture capital funds. Now, all of these may benefit from the implementation of psychedelic healthcare, but we all need the field of psychedelics to professionalize and to function as other clinical specialties do in order to realize this potential at scale. And this is why we're highlighting the Psychedelic Medicine Association today. As you will hear, the PMA, as it's called in short, has a proven track record of success, efficiently using resources to achieve their objectives, engaging the incumbent medical community, and moving psychedelic healthcare into the mainstream. But let's take a moment to get the lay of the land and understand the challenges ahead for psychedelic therapies after FDA approval and why this is such a heavy lift. So we're just going to pull up some slides very quickly. The first slide represents what we consider the full spectrum of access to psychedelic therapies. Now, whenever you're having a conversation about psychedelic therapy, it's important to understand which access wedge you're talking about. Medicalization, decriminalization that's happening at the state level, or religious use. All of these access wedges have different regulatory bodies, different rules, different economics, different practitioners who are offering the medicines, different access settings, and so forth. They're unique in and of themselves, and so you'll want to know where the conversation is positioned. Our conversation today will be largely positioned in the medicalization access wedge. However, we will also, as you'll hear from Dr. Morski, we'll also be touching on the state level legalization wedge, because the Psychedelic Medicine Association is unique in that it is able to service the medical communities that interface in both of those access wedges. Now, let's move a bit into talking about the payer landscape. This first pie chart will show you both the private sector, so the government-sponsored plans, and the commercial-sponsored plans. So the commercial-sponsored plans are those that are largely purchased by employers for their employees and their families. These are the big buckets of different payers who will make decisions about covering psychedelic therapies for the populations of people that are under their coverage plans. Now, the red hues are the commercial plans, and these are mostly divided into two big buckets: self-funded plans. Those are the wealthy companies like the Googles of the world that are largely paying cash for their medical expenditures. And then the fully insured plans. And the fully insured plans are the plans that the large carriers themselves carry risk for. So Aetna, United, and so forth. Those plans, the fully insured plans, can actually be affected by state level legislation or by persuading the insurance carriers themselves that it's in their best interest to cover the new treatments, while the self-funded plans are largely influenced by getting those corporate entities to decide that they would like to cover the care. Now, on the government side, the blue hues, those are largely controlled by government entities such as the Centers for Medicare and Medicaid at the federal and state level, and the VA. This seems like it's pretty doable, right, when we see this first view of it. But unfortunately, when we go to a deeper, more granular view, this is actually what it looks like. And what you're seeing here is all of the different entities that will be making coverage decisions about psychedelic therapies. These represent different groups of people, different motivations, different buckets of money, different populations of people, different rules, and so forth. And the really unfortunate aspect of this disjointed payer system is that these wedges, these payer wedges, do not communicate particularly well with one another. So this is why, one of the big reasons why, when you're trying to bring a new clinical therapy and specialty into the US healthcare system, it is critically important that clinical specialty is very well organized in itself so that it can communicate consistently with all of these different access wedges. And they can receive a message that the field is professionalized, it's standardized, and therefore it is trustworthy to consider for coverage. So basically, it's on us to, and the field of psychedelic therapy, as we should say, to be the glue that helps to hold this payer landscape together with consistent, professionalized information and standards of care. What we've been looking at is the payer landscape. And if you wonder why there's inequities in our healthcare system, why some people get treatment and some people don't, and why there's delays in implementation of innovation in our healthcare system, why it's so expensive, what you're looking at right now is a big part of the reason. And we have to deal with the reality of that situation if we want psychedelic therapies to come into the healthcare system and to be paid for by all of these payers. Now let's look at the care delivery section of the healthcare system. What you see here are the 4 columns of care delivery, or what we might call silos. And each of these silos represent different types of professionals, different licensures, different trainings, different types of services in different care settings in which patients receive care. Similarly to the payer landscape, these silos of care delivery do not work seamlessly together. There is not a lot of efficient flow between them. Medical and pharmacy are the best. They work the best together. And the others, there's just a lot of disjointing that happens. I think that any of us who have tried to access the medical system have experienced this. Be effectively integrated into the healthcare system, you need the bulk of providers in each of these columns, in each of these silos, to be trained with an adequate degree of quality, with a consistent base of accurate information, and for those who take on the most training to deliver that care within agreed upon standards set by the community of practitioners. These standards are best set and monitored by a membership-based organization, such as we see with the American Medical Association, the American Psychological Association, and the American Psychiatric Association. And as you will hear, the Psychedelic Medicine Association is perfectly positioned to do this for the field of psychedelic therapy. So in closing, the essential tasks for the field of psychedelic therapy to enter mainstream healthcare are this: set standards for practitioner training and care delivery. Then use those standards to educate and train a workforce to deliver that care safely and effectively. Organize a membership association like the AMA and the APA that can interface with the incumbent healthcare systems and medical establishment and can leverage collective wisdom and bargaining power in those systems. And there is a fourth. The field also needs to establish a professional certification for psychedelic therapists from a nationally accredited certification board. And this is similar to a clinical licensure. Everyone here has heard of a board certified doctor. Now, these professional boards are well-known consumer protection entities which can help payers establish their networks so payers can cover these treatments. And this certification function is the work of the Board of Psychedelic Medicines and Therapies, which we hope to highlight at a future Delphi Insight session. All of these activities are highly complex and time-consuming. We need immediate and efficient action from organizations with a proven track record to execute these essential tasks for the field. There are no other organizations prepared to achieve the majority of tasks above as the PMA, not the AMA, not the APA, or any other known entity. And so I'm very pleased to present to you Dr. Lynn Marie Morski, founder and president of the Psychedelic Medicine Association. Dr. Morski.
Thank you so much, Leah. I truly appreciate that introduction, laying that groundwork for us. And I want to send gratitude to you and the entire Delphi team for organizing this. As Leah said, my name is Lynn Marie Morski, and I'm so grateful for all of you showing up today and for the dedication that I know each and every one of you has for developing the field of psychedelic therapies. Now, by training, I am a board-certified family medicine physician and an attorney and member of the California Bar. And before I entered into the field of psychedelics, I was a physician at the VA for 9 years. And during that period of time, I saw veterans day after day with conditions like PTSD, traumatic brain injury, and depression that were very difficult to treat. I saw how much they were suffering and how nothing that we were doing was having a significant effect. And it was during that same 9 years that I learned about psychedelic medicine and how it was able to address a lot of those same conditions. However, as a Department of Defense contractor, I was not allowed to tell the veterans about what I knew about psychedelics. And as a physician, we take an oath to first do no harm. And after a while, I felt like I was definitely doing harm by omission, by not being able to share what I knew. And so in 2019, I left the VA with a mission. And that mission was to educate clinicians on psychedelic therapeutics. So the clinicians in the future, when patients show up to them suffering from these conditions that are really difficult for them to deal with in their life, like PTSD, depression, all of the things that we know psychedelics can address, that they would be able to discuss those psychedelic options with their patients competently and refer those patients to psychedelic therapists comfortably. Now, I started first by creating the Psychedelic Medicine podcast, but soon realized that was not the most efficient way to get education to clinicians. And that was when, in September of 2020, myself and my co-founder, Barney Neal, founded the Psychedelic Medicine Association. The Psychedelic Medicine Association's mission is to educate healthcare professionals from across the spectrum on the therapeutic potentials of psychedelics, bridging the gap between what's going on in the field of clinical research and the clinical trials and what's going on in the front lines of healthcare. We also are dedicated to building the necessary infrastructure to seamlessly integrate psychedelic-assisted therapy into the mainstream US healthcare system. I just want to tell you a little bit about our members first. We have a very engaged, dedicated membership base, and we have educated them through the following methods. You'll see there, we have our continuing education course. Every month, we have a deep dive webinar into a different topic like psychedelics for eating disorders or best practices in ketamine therapy. Every month, we provide a research bulletin that has the latest clinically applicable findings from the world of psychedelic research. We send them home with informational guides, and we also have a quarterly journal club. Now, how engaged our members are, you'll see on the right, because a number of them have come to us and said, we want to start local PMA chapters in our community. And we were so grateful that they did. And you'll see every place that there's a red marker, there is a local PMA chapter. In addition, we had members reach out and say, I want to get together with members who have my same specialty. And so we have special interest groups in addition to our local chapters for things like end-of-life care and substance use care. Now, you'll see there, we have 1,200 clinician members, but we also have 80+ organizations who have joined us. And those organizations come from across the field of psychedelics. Organizations like MAPS, Journey Clinical, Osmind, Fluence, organizations who are dedicated to join us in our mission to educate healthcare practitioners. Now you'll see, as I mentioned, our members come from across the healthcare spectrum. We've got MDs, PAs, NPs, and we've got social workers, counselors, and therapists from the therapy side. Now, in the lower left-hand corner, you'll see that not only have we been fortunate to have this engaged membership base, but also we've had a lot of traction both on social media and coming to our website, which tells us that there are a lot of clinicians interested in learning more about psychedelic medicine. As Leah said, we are at a very crucial moment. As MDMA-assisted therapy and other psychedelic therapies come forward for FDA approval, it is imperative we have an infrastructure in place that will give trust within the medical community so that we can secure those approvals. Now, as she said, the AdCom meeting did not go so well. And what would it look like? How would it have looked maybe different had there been an infrastructure in place to make them feel more confident? Many of you know that after that meeting, the Institute for Clinical and Economic Review, ICER, put out what they call their final evidence report, in which they made the following recommendations. Rigorous certification and oversight of providers is of the highest importance and should include entities other than the manufacturer, such as the American Psychiatric Association and the American Psychological Association, to reduce potential conflicts of interest in maintaining the highest standards. They went on to say different models for certification could include a two-step process, with manufacturer certification as a first step, followed by specialty society certification. They also said training, certification, and oversight is needed for both medical providers who will be prescribing these agents and the therapists who will provide psychedelic-assisted therapy. The Psychedelic Medicine Association is well positioned to steward the creation of that type of infrastructure that ICER mentioned that we know is necessary for the effective implementation of psychedelic medicine. Now, for those of you who are not in medicine, I want to echo a little bit about what Leah was talking regarding accreditation. So currently, if somebody wants to become a therapist, they would undergo a system of training, something like a master's program, and that program would be accredited by the APA, the American Psychological Association. And after graduating from an accredited training program, they would then be eligible to sit for their licensure exam. And then you would have a licensed, credentialed therapist. Similarly, the Psychedelic Medicine Association plans to design and implement an accreditation program for the psychedelic assisted therapy training programs geared towards preparing practitioners for this certification exam that, as Leah mentioned, the Board of Psychedelic Medicines and Therapies will be administering. And so if a psychedelic assisted therapy training graduate from an accredited program then sits for the board exam and passes, we then have a board certified psychedelic therapist. Now, one other piece of infrastructure that we'll get into in a minute is guidelines. There's something called clinical practice guidelines that are necessary to enhance the quality of care as well and improve patient outcomes. That's another big chunk of the infrastructure that needs to be in place. And the third thing, as Leah mentioned, the APA is a membership organization, just like the Psychedelic Medicine Association. And we have developed, as I said before on that slide, and we will continue to maintain a strong membership base so that we will be recognized to represent the field of psychedelic medicines and therapies in conversations with government and industry decision makers. Just before I get to our plan, I wanted to highlight a few of our accomplishments that we've made over the past 4 years. As Leah so kindly pointed out, we have been very efficient with our member dues in creating the following things. You'll see there on the left, we have our continuing education course. Now, this is where we were able to interface with the state level programs because we realized that the PCPs of Oregon, the primary care providers, were going to be faced with a situation where patients would come into their office and say, I hear that I can legally do psilocybin. I have depression, but I'm on lithium and an SSRI, and I have a first-degree history of schizophrenia. Is this safe for me? And since we were taught nothing about psychedelics in medical school and residency, we feared that those PCPs would feel really uncomfortable and unprepared. And so we created this course to help familiarize them with psilocybin, familiarize them with the Oregon protocol and how the system works in Oregon, as well as helping them manage the risk of their patients by giving them the most available evidence. And we are in talks with the Healing Advocacy Fund to create the same type of course for Colorado to help the clinicians of that state when that rolls out. You'll see below that, we were very fortunate that Psych Congress came to us asking us to work with them to create the first ever clinician-focused psychedelics conference. It was called the Sana Symposium, and it ran for 3 years. In the middle there, you'll see our booth at the American College of Physicians International Conference. We were the first ever psychedelic-focused organization to have a presence at that conference, where there are 7,000 internal medicine clinicians, residents, and students. And I just have to tell you, I sat at that booth for 3 days. Clinician after clinician came up and told me their patients are already asking about psychedelics, and they were very interested to learn, which was very hopeful for me. You'll see on the right as well, we've been asked to give grand rounds at places like Stanford and LSU. We've been asked to speak at the American Medical Student Association and on the news a couple of times. And in the lower corner, you see something that I'm most excited about. If you're familiar with Medscape, they are the leading clinician education organization in the United States. They have an audience of about 12 million physicians, and they came to us to do a joint grant where we will be exploring the knowledge of clinicians specifically on psilocybin therapy for the treatment of depression. Now, I'm going to get into a little bit more detail on those pieces of the infrastructure that I mentioned before. So clinical practice guidelines, the definition there is that these are evidence-based recommendations that aim to optimize patient care, and they're developed by reviewing all the scientific evidence, like for example, from the clinical trials and expert consensus. The role that they play is they help enhance patient safety, they improve cost effectiveness, and they also provide a legal liability framework that protects both the patients and the practitioners. And you'll see there below, this is something else that ICER mentioned in their final evidence report. They said as soon as possible, clinical specialty societies should rapidly develop clinical practice guidelines to guide optimal practice with novel treatments. Now, what does this look like? This is quite a complex process. Now, don't worry, these slides are sent home with you, but I just show you this to illustrate that this is a lot of work. There is a lot to do to accomplish creation of these new guidelines. This is just giving you a sense of what's involved. Now, this is the accreditation program that I was stating was necessary and that ICER also pointed out. Again, you'll have these slides at your disposal, but the reason that there are so many steps is that these are formal technical processes that are that way because that is what is required by the rigorous standards of the healthcare system. But for ease of discussion, I wanted to point out just here on the operations thing, what this actually looks. First, to create an accreditation scheme, you have to speak with the people in the industry that would be interested in your accreditation. So speaking with training programs like Fluence, Polaris, IPI, et cetera, all the programs that we know, getting their buy-in, speaking with them about what should be involved. And this is when you decide things like, should the accreditation require an in-person practicum, and how many hours of training, and what kind of subjects should be covered. Then once that is established, programs would apply to be accredited, at which point the PMA would send somebody to do a site visit because you have to verify that what they're saying about their training is in fact accurate. And then if they're granted an accreditation, then that has to be renewed every couple of years. You'll see there the renewal processing is mentioned. And then finally, we have to get feedback and evaluation. We know that this field develops so rapidly, we have to ensure that what we have included as our accreditation scheme stays current. Now, with your support, we could build the necessary psychedelic infrastructure. We know that there are two critical factors here. We know we need a robust, credentialed psychedelic workforce and comprehensive clinical practice guidelines. These elements are essential to convince payers to cover psychedelic treatments, which is the key to making these therapies accessible to patients in need. We know the average American cannot afford psychedelic medicine as it currently stands. And so as you'll see there on the right, as Leah mentioned, you need licensed accredited therapists plus clinical practice guidelines to get the kind of insurance coverage and market access that is required for wide distribution of these therapies. Now, with your support, the Psychedelic Medicine Association can accomplish getting 5,000 healthcare professionals graduated from an accredited psychedelic assisted therapy program over the coming years, and publish clinical practice guidelines that will lead to informed prescribers and providers. Without your support, psychedelic medicine may continue to struggle with FDA approval due to this lack of infrastructure. And unfortunately, we know that there will continue to be a lack of access to life-saving therapies for patients in need. Because I don't have to tell you, we know that too many people every day are lost to suicide, and too large a percentage of the American population is suffering from anxiety, depression, and PTSD, things that we know psychedelics are very effective at addressing. How do we plan to make this happen? We have listed this out in 3 phases. The first phase gets us through the end of 2024, and we are requiring 150 to 200,000 to achieve the following milestones, including stakeholder engagement, like I said, getting people from the programs together, assessing what is necessary to be included in this accreditation scheme, defining the scope, defining the faculty requirements, and setting up an accreditation committee and a CPG writing committee. The bulk of the work happens in phase 2, which would be 2025, which we think will run about 450 to 500,000. And that includes actually creating the application process and piloting a trial accreditation process, getting feedback and development of that, and then publishing the clinical practice guidelines. And then in phase 3, it's that last mile. We think it'll be about 250 to 300,000, where we publish the accreditation scheme. We go widely open for applications. We promote our scheme, we market it, because the accreditation scheme will be recognized and successful when training programs go through it and join it. And then when that for them becomes a mark of honor, like we are an accredited training program, and that will attract more students to their program. We also, at that point, hope to have accredited over 50 programs, and we'll be evaluating the effectiveness of the clinical practice guidelines that were published in phase 2. And we're on track to becoming self-sustaining, and we're asking for the essential funding that we need to become a revenue-generating organization that breaks even with our operational costs. We're asking for an amount that represents a time frame here and activities that need to occur in that time frame while we become a self-sustaining organization through revenue drivers such as application fees, site visit costs, and annual membership dues, as you can see in the upper right corner. Now, just a little bit about our team. We are so honored to have so many luminaries from across the field of psychedelics, as well as from across so many different fields of medicine. You'll see here, we've got on our advisory board a social worker, psychologist, nurse practitioners, MD, and a pharmacist. And that's because we have clinicians from across those fields as members, and we wanted to know how best to educate members from across all of those areas of medicine. In addition, here you'll see my co-founder and chief technology officer, Barney Neal. He is also the graphics guru that has made this presentation look nice, so thank you, Barney, for that. Together, we can change the lives of millions. The Psychedelic Medicine Association is well-positioned and ready to develop the necessary psychedelic healthcare infrastructure with your support. We are grateful for your time in reviewing our mission. Thank you.
Thank you, Lynn Marie. That was an excellent presentation and really, I think, helped us all understand better the essential nature of your organization. And I just want to, as a doctor, you are making a case for human health, for public health and wellness. I also want to emphasize the business case here. And when we're looking at the sums of money that it takes to carry out the complex tasks that your organization needs to do, that pales in comparison. It is a drop in the bucket compared to the return that will come from payers in the healthcare system actually paying for these therapies, and everyone from care providers to those who have invested through funds or philanthropically into psychedelic therapies, and not to mention the benefits to society at large that we anticipate seeing. So we want to keep your ask in perspective for everyone who would like to see the ROI of psychedelic therapies, which we expect to be immense. So thank you so much for you and your team and all of your incredible work. We'd love to open the pathways and the communication up now for Q&A for those in the audience to ask any questions that they may have.
Hi, my name is Julia Mandy, and I'm with the Delphi team. The first, I'll start with, what are some of the ways in which PMA's intended work will relieve the bottlenecks in patient access to psychedelic therapies?
Great question. Thank you, Julia. So there are two main bottlenecks that we hope to relieve. One, as we know, is the therapist bottleneck, right? There are not enough therapists. And we are hoping that by this accreditation scheme, we can thereby attract more students, because I know I've heard this sentiment from a number of students at this point. They want to get trained, but they're unsure which program to take because they know that some kind of certification will be coming and they're afraid to take this program and it's not going to be certified and I'll have to spend the funds to take another program. And we know that these are not inexpensive programs. And so to have a certification and accreditation process where they know this is a program that is safe for you to take, it has all of the characteristics that you'll need to become a fully competent therapist, and you'll be able to sit for the board, will really help that bottleneck. In addition, on that clinical practice guidelines slide, the CPGs actually serve a very important bottleneck relieving feature, because if you can imagine, say MDMA therapy gets approved, we will have a slew of patients who want to get MDMA assisted therapy, but first they have to go through the medical clearance. We know, especially if you read Michael Pollan's book, not everybody is safe to undergo MDMA assisted therapy. Who decides that? A physician is going to have to decide that. And based on what? Clinical practice guidelines. That's how this works. And so without those guidelines, we're going to have all of these patients coming to their physician and say, am I safe to do this? And the physician is going to have no means by which to give them that clearance, because again, we were not taught anything about this in medical school. So the clinical practice guidelines will also help relieve that bottleneck.
Thank you. We have another question here. Will your accreditation be offered for multiple disciplines? And if so, which ones?
Yeah, so that is the goal, is to look at all of the types of, like I said, we have in the PMA, social workers, counselors, therapists, all of that, doctors, NPs. And so, yes, at this point, focusing first on the licensed practitioners and across all the specialties. So those licensed practitioners obviously will still be responsible to their own agency, let's say social work. They will still have to continue to maintain their social work license, but this will be an added certification they will have on top of that.
Thank you. Which mainstream medical organizations has the PMA forged relationships with?
We've already spoken with the American Psychological Association. They were very excited to speak with us. They sent 7 people to our introductory meeting, which was very exciting. And then as we became deeper into the accreditation process, we've reached out to, they have a separate council on accreditation. So as I said, the APA is responsible for the accreditation on the therapy side. And so we are in contact with their council on accreditation. We also have established contacts within and met with the American Counseling Association and Mental Health America. One of our former interns now works at SAMHSA. So we are very fortunate that a lot of mainstream groups have been more open recently to meeting with us and starting a dialogue. And Medscape, they work with nearly everybody, and they have been very generous with their contacts to this point. And so they have vowed to help us reach out when we need further organizations to be in concert with.
Can you speak a bit more to the near-term team building requirements of the PMA? Are there any specific roles you need to hire for in order to build the accreditation scheme?
We would need an accreditation operations manager. I am still going to run the PMA, but as we said, the accreditation specifically is one portion of this. CPG is another area. Accreditation is probably the most in-depth, but CPG as well. So that is something I would focus more on the CPGs, and we'll need an accreditation manager that will take care of managing the projects in that. And then we will also need things like fractional CFOs and accounting, people who are less full-time, but mainly it's the accreditation program that we'll need 1 to 2 full-time people for that one.
Thank you for that. What kind of feedback have you received from the medical community regarding your programs?
The mainstream medical community has changed so much since we started the PMA. They were much more reticent at the beginning. And then as you'll see, a number of papers have come out about this. They are much more open and willing to learn at this point. And I think part of that is because so many of their patients are already asking. And so I just had a booth at Medscape Psychiatry Update Conference where psychiatrist after psychiatrist came up and said, my patients are already asking, where can I send them? They're very open. And the ones that have taken our training have expressed that, wow, thank you for turning me on to some of the more specifics so that I can answer these questions. And then what's also been very interesting to see from our members specifically is that once they go to enough webinars or take certain trainings of ours, they become more interested in perhaps also providing the medicine. We were initially getting people who were very unaware, but they go from unaware to curious to believing so strongly in it that they want to add this as a tool to their practice, because for so many of the things that psychedelics can address, physicians have been frustrated at their lack of ability to address those for years. Somebody comes in with PTSD, they're on 2 medicines, already getting therapy, nothing's working. That's frustrating for the patient and the provider. And so the providers, oh, we have these options that are more efficacious. And so a lot of them go from curious to learning to wanting to provide the therapies themselves.
Thank you, Lynn Marie. Are there types of organizations that you are thinking of accrediting, more like the Fluence, IPI, Prati, or the mainstream graduate programs?
All of those, anybody who applies. And that's where we would love to work with the organizations who are currently training. We know that there are institutes like CIIS and Naropa that are more on the part of an educational institution, as well as on the other end, we've got the Fluences that are more independent. We want all of those stakeholders to come to the table and discuss with us the best way that our accreditation could accommodate both types of tracks.
Thank you all so much. Wonderful questions, Lynn Marie, to you and the Psychedelic Medicine Association. Bravo with all you've accomplished and all that you will accomplish moving forward. We want to remind everyone in the room, there are multiple links in the chat where you will be able to follow up with Dr. Morski directly and learn more about her organization and how you can form a relationship and become a supporter. We look forward to seeing all of you at a future Delphi Insight session, and we wish you a wonderful rest of your week. Take care. Bye-bye.
Thank you, Delphi. Thank you, everyone.